All right, guys, good morning. This morning I'm going to show you something that I find very important for managing soreness and then also improving your mobility. Two things that are going to be really important for our quality of life. I notice as I get older with my training, the more that I program in or work into my routine, some soft tissue work, which is what I'm going to go through today, known as foam rolling. The better I feel, the better I can move, and the less sore I am. So you guys will notice some foam rolling instruction in your workout this week and in the coming weeks. So I want to kind of talk you through that, so you know what you're doing and why you're doing it. So what foam rolling does is it basically is kind of similar to a deep tissue massage. And it's going to break up the scar tissue that is between your actual muscle tissue and a layer of connective tissue that protects your muscle. And we can oftentimes get scar tissue built up in between those two layers, and that's how we get tight. So if we kind of break that up weekly and do some stretching, it really helps with how we move, and will keep any of our joints from taking any of the abuse of walking around with tight muscles, which can lead to some kind of worse problems, specifically with our knees, our hips, our ankles. Okay, so as long as we're working these problems out weekly, they never really grow into a big thing. So I'm just going to run you through a lower body soft tissue routine. Really pretty easy. Can take you just a couple minutes, and then add in a little bit of stretching. Might take you 5-10 minutes, a couple times a week. This will go a really long way. Okay, so first one we're going to do is we're going to get up into the hip, and we're going to foam roll our glutes in a muscle known as the piriformis that actually runs up and attaches into our lower spine. Okay, so all I'm going to do is just cross one leg over like I was sitting cross-legged. Okay, what that's going to do is expose that muscle to the foam roller, and now from here, just going to roll back and forth. Okay, so the leg I have crossed over is going to be the leg that I want to roll here. Now, when you initially do this, you might feel what's known as a trigger point. So in an area of that muscle that's really, really sore. It's not a bad thing. That just means this is kind of long overdue. Okay, I like with each one of these, we'll go about 15 to 20 rolls. Okay, so after that one up in the high hip, okay, I'm going to transition to my IT band. Now guys, with foam rolling, you're in control of how much of your body weight you put onto the roller. Starting out, this is just like anything, starting out, it's going to be a little bit sensitive, but our body adapts to it, and it gets a little bit easier. So I'll kind of talk you through that. So when I'm doing my IT band, I want to go from hip to knee here. So I can use this opposite leg here and control my body weight. So I can put very little weight on the roller, or I can put a lot of weight on the roller. Now, when I first started foam rolling, my muscles were too sensitive to this, so could not do this, okay? But I do this all the time, so I can really dig into my IT band there. Same thing, 15 to 20 rolls, hip to knee. Okay, then I like to transition over, and I'm gonna hit my hip flexors next. So just get into that trigger point I was feeling with my high hip. Okay, hit that hip flexor. Okay, this one I'm just kind of going mid-thigh into my hip. Once again, you'll feel kind of a tender area in there. 15 to 20 rolls. Then I can go to, and then once again, I can control if I want less weight on there. I just put more weight onto my grounded foot. Then from there, I'm gonna do my entire quad. Okay, entire quad, I want to go from knee to hip. Okay, and then you can notice I'm rotating my leg. Your quad is made up of 4 muscles. There's one on the inside, one on the outside, one right down the middle, and then one deep to that one that's right down the middle. Okay, so I want to hit all of those, rotate my leg around, bend my knee to expose the muscle more. Once again, if that one's sensitive to you, that one will be sensitive initially. You can put more weight on your grounded leg. Lastly, we'll hit the lower leg or our calf. Okay, if I want it to be just nice and